Sorry, we had a few technical glitches, but I think we're sorted now. Hopefully everybody can see the screen that we're sharing because we're all online. Can I start today by acknowledging the traditional owners of the land on which we're meeting virtually, the Noongar people, or the Whadjuk people of the proud Noongar Nation, and pay my respects to elders past, present, and emerging. Can I ask today that you make sure that if you are not speaking or that you have your microphone on mute, because the background noise is hard to control and we can't hear very well. We will have somebody monitoring the chat, so if you have questions, I'm more than happy for you to put them in the chat, and we will also have time for questions at the end of the session. What we're going to focus on today is just giving you an update about the policy position, and then also we're going to talk about workforce and OSH issues. So we've got Cynthia Sinicati from Workforce and Andrea Carlin from OSH to provide you with a bit of an update, and you can ask some questions that you have. So what we want to, I guess, this is just an outline of what we're going to look at. I'll talk really briefly about the new SAR, the System Alert and Response Framework, the mandatory vaccination, and then we'll move on to the working from home guidelines and PPE training and fit testing, COVID fitness to work, and then the OSH assessment for exemptions. So I know this is a really busy slide, and I think most of you will have had access to the updated SAR, the updated System Alert and Response document. As you can see, at the moment, we are in amber, and really we are operating on the basis of what is in this document. So this is the most current information that we have from the department. I want to take the opportunity right now just to say that this is an ever-changing feast. So we come in the morning and we know one thing, and by 9 o'clock we know something different, or even of an evening sometimes we get updates. So please bear with us. We are trying to get information out to you as quickly as we can. What we don't want to do is put information out that we then have to retract 2 minutes later that's then incorrect. So we are trying to get information out to you in the best way. I am cognizant that some people who work across sites are seeing things different at different HSPs. We are working with other HSPs to try and get some consistency. So look, I think we will get better at this. Do we have it right absolutely at this moment? No. But we are trying to get as much information out as we can that is correct and that is timely. So as I said, we are in amber at the moment. So if you have access to this framework and the document, the criteria that we need to abide by and be compliant with is in this document. In terms of new policies and guidelines, probably the one that I want to focus on and the one that's probably given us the most grief over the last couple of days is the visitor policy. Where we've landed on this is we've changed the visiting guidelines, which I'm hopeful all of you are aware of. So visitors can attend between 10 and 12 and 5 and 7. They must QR code in, they must do hand hygiene, and they must show proof of vaccination. Now, there are occasions in which we will make concessions for people who are unvaccinated to visit loved ones in the hospital. At the moment, we are keeping that decision at the DCS or the ED discretion. So if you get a request from somebody or somebody rings the ward and says, this is what I want to do, please feel free to either ring myself or Ajitha, and we will give you some direction in that space. We would hope as we go on and that we get more clarity around this, that we are able to devolve this down so it's not just us making the decision, because I completely appreciate that I'm not always at the end of my phone or on my emails, and so I may not be able to respond as quickly as you would like, but I will do my best to do that. The other thing is, if somebody is, so the premise on which we make the decisions is about, is it compassionate? Is it a compassionate care? So is it because somebody's imminently dying and their loved one wants to come in and see them? There's some specific requirements around maternity patients. So if you are a birthing partner, then there's some specific requirements around that. And we will restrict you. You will be escorted to and from the ward, which again, we recognize is potentially a problem in terms of resources and making sure we can. We are in full amber at the moment. So your decision, sorry, just in terms of, yeah, the SAR documents available on the internet. And thank you, Ajitha, she's put it up online. So the decision will be made on the basis of a set of criteria, and we will limit people's time as well. So we will give them an hour's time period to come and visit if they are unvaccinated. We'll leave the questions until the end of that. Other visitor policies. I think that's about it. As you know, all the visitors are meant to be entering through the piazza. And I know we have set up some tents now. As it gets hot, we've tried to put as many people, wayfinders, on the door as we can so we can process people quickly. We will be sending out something shortly about staff access, and we want staff to access through a separate doorway. Now that staff will include anybody who has an ID. So whether it's, if Path West have an ID, if Nurse West, anybody who has an ID that says they are a staff member will be able to go freely and swipe through the door or be allowed through the door. If you do not bring your pass, you will be asked to show proof of vaccination and you will be asked the screening questions. So please do not forget your pass, because we cannot, it's not up to the doormanners or the security guards to know whether you're a staff member or not. I appreciate you might have a logo on your uniform, but if you don't, if you're just wearing scrubs like I am, I could be anybody. So please make sure if you're coming through the staff entrance that you actually have your pass with you so you can swipe in. If you can't, you will have to go through the main entrance with everybody else. So we are trying to lock down as many doors as we can so that we have minimal access points to the hospital. We would really appreciate if staff do not allow patients in behind them. And I know that is tricky. So when you scan yourself in or swipe yourself in or out, if there's a patient or a group of patients following, please say to them, you need to go through to the piazza. Now, if you get pushed back, we're not expecting you to then take it on. I understand that, but we are sending out correspondence to patients and patients' families. We are putting flyers on meal trays to say there is one point of access to the hospital. It's a very big campus, so therefore we do have multiple points of entry, and we are trying to make it as efficient as possible whilst not having to use resources to man every single door. So as you will appreciate, that's not ideal. Okay, I think that's probably it around the policies and guidelines for now. I'm going to hand over to Cynthia Sinicati, who's the Area Director of Workforce, and she's going to give you some updates. Just to answer your question around unvaccinated, we will be unvaccinated visitors. We will be sending out some links today in a global. So the global will just be high-level points, and there'll be 2 documents that are hyperlinked around unvaccinated people attending, and then the second one, which links to the link that Geetha just mentioned in her chat. So we'll provide that to you later today. We were just trying to get feedback from everybody. Okay, I'm going to put my desk down because Cynthia is considerably shorter than I am, in a good way.
Keep going.
Is that okay?
Yeah.
Okay, there we go.
Hi, everyone. Sorry,
You can just use this. You can just use that.
Oh, that. Yeah. Okay, lovely. I'm Cynthia Sinicati, and I'm the Area Director of Workforce. I just thought I'd give you some updates on some key matters that are happening in our space. The first one I'll be talking about is mandatory vax. Sorry, for boosters. Actually, it should be okay for me. Sorry, I'll just take my mask off. Then I'll be talking a little bit about the working from home guideline that has just been recently released. Talking a little bit about PPE training and fit testing, and then the COVID fitness for work process and the COVID OSH assessments for exemptions. So Andrea Carlin is here from OSH with me, and anything I can't answer, I'll throw over to her to answer. So in terms of mandatory vax, I think everyone would be aware by now that the next critical date for us is Saturday, the 5th of Feb, when we're expected to have had our booster vaccinations, if we're eligible. Please let your manager know if you cannot meet this time frame or intend not to get a booster. immediately. Otherwise, can you please ensure that you upload your evidence using the online forms? If you are experiencing issues with the forms or uploading, you can contact the COVID workforce inbox, which we'll provide later, but it's a COVID-19 North Metro workforce at health.wa.gov.au. So there will be someone to assist if you can't upload. Sometimes people are actually sending their VAC certificates to that inbox to be uploaded, so we can assist in that way as well.
Can I just say one other thing?
Sure.
Can I just say, guys, we sent out a list to all of the co-directors and to your nurse managers to follow up. So at the moment across North, we have 1,900 people who haven't uploaded or haven't had their boosters. We think a lot of it is actually about the fact that they haven't uploaded them. I think at Charlie's now we're almost at 1,000. So we really, really encourage you to please upload or send it through to this box so that we don't have to be chasing you down to upload it. If you've actually been compliant and you just haven't uploaded it, we can help. We just need to get it done.
Yeah.
Thanks.
Thank you. Okay, the next issue I want to talk about is the working from home guideline. This is a revised guideline that outlines the principles and scenarios under which working from home will be considered. There has been a change from the last time the guideline went out, maybe 18 months ago. All North Metro staff are considered to be essential workers. Even when there is community transmission of COVID-19, vaccination coverage allows us to continue working and attending at work with appropriate precautions in place. So working from home will be used to address specific circumstances, but not as a general rule. Staff requesting to work from home will need to complete a new request form given that the directions have changed or the guidelines have changed. So if you have previously applied for working from home for COVID reasons, and you were approved, you will have to apply again because, as I said, the guidelines and the nuances changed. Staff who are approved to work from home will be responsible for providing their own home office equipment and a suitable defined workspace at home. So the working from home guidelines have been released and they are on the intranet. But again, you can email the COVID workforce box if you've got any queries or would like information. The next topic I'd like to cover is the PPE training, which is now mandatory for all staff. I might put the last thing first and say that staff will be prioritised for the PPE training, depending on their roles and work areas. So we will be prioritising clinical staff who potentially will be working in risk areas, as opposed to corporate staff, etc. So I feel like I'm speaking to the converted here that we'll need to ensure that everyone knows how to put on their gowns and gloves and masks and eyewear safely, as well as how to remove and dispose of them. PPE breaches can occur at this point, so we need to make sure that people are doing it safely. And if you are unsure, you ask someone to spot you. Andrew, do you want to add anything to that?
No, I'm just here in case any questions come up.
Face-to-face training should be undertaken by all roles, and there are emails galore about where you can log into or book in to have your PPE training. We are developing a plan across Sir Charles Gardner and Osborne Park to support managers and staff. So hopefully that's self-explanatory. In terms of fit testing, again, a decision has been taken to ensure that all staff, clinical and non-clinical, will be required to complete a fit test to ensure that your N95 respirators are fitted correctly. This is obviously a change from last time round, where we focused on high-risk areas and clinical staff only. Fit testers are available at Sir Charles Gardner and Osborne Park, or you can also attend at other North Metro sites, but you must do a booking. And again, information is on the intranet where you can link in and book in for your fit test. Please note that clinical staff who will care for COVID patients or staff are required, or staff who are required to enter high-risk areas will be prioritised. So again, we have finite resources, we have a short time frame, so we'll be focusing on the areas of highest risk first.
Can I just add one thing there? If you're working in an area and N95s are now mandated and you haven't been fit tested, please just attend any fit test location to be prioritised. That includes students as well, and people that may not have received communication from us. So everyone entering areas that are high risk, including ED, and those that are requiring airborne or high risk procedures, AGPs, etc., must be in an N95 and you must have been fit tested.
Thanks, Andrea. COVID fitness for work. We've developed a new fitness for work process, particularly in relation to COVID. So some North Metro staff may have an underlying chronic health condition which may place them at increased risk when managing patients with suspected or confirmed COVID-19. Staff who work in departments or areas that may directly treat suspected or confirmed COVID patients and have nominated conditions are requested to advise their line manager of their condition. So this information is available on the internet.
Yep.
And there is a risk assessment form that your manager will fill out with you. And then basically it is a risk assessment. If the issue cannot be risk mitigated currently, then it will be sent to OSH for an assessment, and then they will assist in determining whether there is an ability to maintain your substantive role safely or if alternative solutions are required. So not all assessments will go to OSH. It depends on, there's a whole raft of things, including diabetes, etc., but it's about uncontrolled diabetes as opposed to diabetes. So there are always
Cynthia, you've gone on mute. We haven't heard what you said for the last half a minute or something.
That is so weird. Thanks, Aditha. I didn't even touch that. Okay, so do I have to start in fitness for work again? Has everyone heard about the fitness for work or not?
We only lost you for about 20 seconds or so.
20 seconds. Okay.
Yeah, the last thing was about uncontrolled diabetes.
Yes, thank you. So essentially, there is a fitness for work process in relation to the risk factors for COVID. So if staff do have issues that their manager's not aware of, that they feel are putting them at risk, that then they need to let their managers know. There will be support from HR and OSH to the managers, as well as to the staff to explore these issues if required. No, it's not. It's not.
You have to click. Yeah. Okay. Okay, try it now.
All right. In regards to the OSH assessment exemptions for masks, I'm sure we all know that as of January the 21st, only surgical masks are to be worn by staff and visitors. Cloth masks can no longer be worn. OSH assessments can be arranged for staff who experience difficulties wearing masks by completing an OSH incident form. OSH nurses will then conduct the health assessments, including liaising with medical specialists, and then those with OSH exemptions can wear their cloth mask in non-clinical areas. So this exemption will only be like, for example, for corporate staff or for staff in non-clinical areas. That's the end of my presentation. I'm happy to take questions.
Sorry, I've just jumped in. It's Mari here, Mari Slater. Would it be possible to say something about, just as I go around, I'm getting a lot of questions about the COVID leave, if somebody becomes a contact, just to clarify, staff think they have to apply to Centrelink or the health department to get a specific payment, I think.
Mari, this is a question that hasn't been answered yet. So I believe that government sector labour relations are working on a new circular that will talk about the different types of leave. At the moment, we understand that it'll be a leave of absence, but we're not sure whether it's going to be your personal leave, COVID leave, or what leave. So I think it may be another type of leave, but we actually don't have a process for you yet or a leave type for you yet. So I don't have an answer there, I'm sorry.
Okay, thank you.
Hi, can I ask a question?
Yeah, sure.
Can you hear me? Okay,
Yes.
so it's just regarding uniforms. So my husband works at Joondalup and they've been instructed not to go to any public space with the uniforms on. Do we have any instruction like that?
Uniforms. I'm not. Do you know?
I believe there's a guideline coming out to state that uniforms are not to be worn in public places. I think that's still in the pipeline though.
Thank you. Kerry? Sorry, you're on mute.
There we go. I'm sorry. The working from home request form link
Yes.
at the bottom of that document is going to a blank page that says this form is closed.
I'm not sure why that's happening, but I'll take note of that. I wonder whether, have you tried it on have you tried it on the intranet and it's closed, or you?
I've clicked on, I just clicked on the link in the document.
On my presentation?
Oh, no, in the actual document itself. So I've clicked on the link from the global
Okay.
that came out earlier.
All right, let me make a note of that and I'll just make sure that that's rectified. And
just need some clarification around level 2 and level 3 surgical masks and having to wear eyewear. So we've gone back to level 2 masks in the non-high risk areas, but we're now having to wear eyewear as well. So I'm not sure why. Yeah, some clarification.
So the eyewear is a requirement under the SAR, the EMBA phase 1.1. The PPE guidelines in that phase requires everybody in a clinical patient-facing areas to be in eyewear, and that's the rationale for eyewear. There has been no other changes to the requirements around surgical mask. There's obviously been changes to the requirements around the type of PPE that is worn in the emergency department. So everybody is required to be in N95 and face shield or goggles, and aerosol generating procedures. There's a Charlie specific guidance document coming out today on masks and eyewear PPE during COVID-19 based on the changes to the SAR document.
Thank you. Thank you.
Any other questions? No?
Hi, I'm not sure if this is coming through. Just a quick question about scrubs. Doctors have been discouraged. I've put this up on the chat, but doctors have been discouraged from wearing scrubs in the past because of the colours being claimed by different departments. I think this is under negotiation with the RMO Society, but it is very difficult for us to outlay the several $100s for these uniforms if we're going to be told that we can't wear them in a couple of weeks. So I was wondering, what's the timeline on sorting out the colour issues and getting us some approved doctor scrubs sort of guidelines that we can order these and get on with it?
Maxine, I was very aware that the RMO Society was working on it. I wasn't aware that the colour is a barrier. I'm really happy to pick that up today and follow up and find out what the barriers are. Absolutely approved. Absolutely approved scrubs for doctors. There is no law or policy saying doctors can't wear scrubs. I'll make sure that we address the colour issue. My apologies, I had been made aware of that.
No worries, thanks.
It's just a hand.
Sorry, someone's got the hand up, but I can't see who it is. If you've got the hand up, sorry.
It's Bajan Singh here. Thank you.
Hi.
I'm not sure whether this question should go to you, Theresa, or someone else, but I just wanted to ask whether there's any update on rapid antigen tests.
Yep. So, Ajitha, do you want to comment, or do you want me to?
No, happy to talk, Bajan. The interim EMBA phase talks about rapid antigen testing and talks about rapid antigen testing in patients in the emergency department specifically. If you interpreted it as those areas where there are direct admissions of patients, that is, I want to say, has started this morning in the emergency department. Just making sure that trace is not, sorry, I haven't been down to the emergency department, but it's all been set up in the emergency department and has started this morning. Phase 1.2 of the AIMBA involves a whole lot more of rapid antigen testing, including patients in high-risk areas and visitors to patients of high-risk areas. We've already set up those stations on Watling Walk, and if you walk towards C Block, you'll find some barricades and set up over there, and the team are working on the flow for when we are required to roll out wider rapid antigen testing. The tests have arrived in the hospital as of yesterday, and as I said, would have started in the emergency department today.
Yeah, thank you. And as a follow-up to that, how will the people doing the rapid antigen tests know which people need to be tested?
So at this point in time, it's people who have epidemiological risk factors who are being tested. ED has zoned into green and orange or red, and all of our orange patients are being tested. Orange patients are patients who have epidemiological risk factors, i.e. been to an exposure site and have symptoms congruent with COVID-19. So it's based on the testing guidelines.
Right, and does that that triaging, if you wish, include whether people are vaccinated or unvaccinated?
Not at this point in time. Obviously, in the subsequent stages, that may be a consideration.
Okay, thank you.
There's a couple of things in the chat which I just thought I would cover off. There's a question around staff having swipe access to other entrances. Wherever you could normally swipe in, that is fine. What we were trying to stop was staff coming in the piazza entrance. So we're going to give them a side door on the E Street that they could then flow through. So if you want to come from the multi-story, you can come through. We will be blocking off, and actually I need to speak to the Met team to confirm this, but the plan is the G entrance, the old entrance to the hospital, will be blocked off because we just cannot man all the doors at the moment. So we will, once that's been decided, once we've had a conversation with the Met team about the risk that poses, and to make sure that emergency management is happy that we have enough egress from the building, we will come out with a plan about exactly which doors, and we will show you, we'll put links in on pictures as to what doors will be open and which of those will be locked down. And the reason we're having to lock them down is because staff are actually overriding them with the button. So it's problematic for us. We're trying to figure it out, and we could, we really need staff's help on making sure that we don't allow patients to follow you behind. But the question about the block basement, so you can park your bikes, absolutely. There's a question around shortage of face shields or appropriate eyewear. Are we able to purchase or bring our own?
No.
Ajitha?
No, you go, Andrea.
Going to say procurement is working hard to stock the floor areas. The problem about bringing your own is that it won't be standard. We can't ensure that you've got the adequate protection, so it should always be supplied by the hospital.
If there is a concern, yeah, I guess we're trying our best to monitor and to keep them locked down in particular areas so that staff can have access to them. Sorry, I'm just having a look. It's a bit hard to read. Where protective clothing is required for specialized tasks, it will be provided by the health service from required photo ID. Yep, sorry, that's an answer. Is there any other? Oh, sorry, there's somebody else with their hand up. Sorry, I can't see who it is.
Just wanted to know if there was some absolute clarification on quarantining for staff who may go over east for compassionate grounds and back. They're possibly under the understanding that it's only 7-day quarantine as opposed to 14 days. And I know that with a furlough, there's a 7-day quarantine. But is there any difference? Can it be escalated on their return if they only do 7 days, or is it a blanket 14 days for everyone if they go to a high risk area?
Ajitha, do you have a?
I think at this point in time, we are following the guidelines based on what the Chief Health Officer directs us from time to time. Obviously, if there are changes, we will provide that information to you at that point in time. The furlough policy talks about healthcare worker exposure and quarantine, and any questions about that can be raised with OSH on a case-by-case basis for that risk assessment, etc.
So just clarifying, it's absolutely 14 days.
Yes, it is as directed by public health if you are being directed by public health to quarantine at this point in time.
Thank you so much. And just to follow up with the eyewear,
yeah.
Some of our staff have asked about getting prescription goggles, so which are of Australian standards. So could that be covered under OSH?
Yeah, can we take that offline and we'll provide some comment for that? I think OSH would like to just take that offline to get some clarity around that, and we'll provide that back to you.
No problem.
Yeah, thank you for the question. Lydia?
I think that was Liz.
Oh, was that Liz? Okay, sorry.
That was me.
Sorry, I can't tell whose hands up. I've just got little other hands, other questions? And we will have a printout, we will have a printout of all the questions as well. It's a bit hard to read through all of them and know what's, so we'll do our best to come back out to you with if we haven't answered any of these. Sorry, I'm just having a look. Okay, anything else? No, anything else from you, Ajitha? Or we'll just have another update next week? Okay, thank you all very much. Janet is back on board next week, so it is very lucky you'll have another staff forum. I will hand back over to her, but in the meantime, we'll keep feeding out the information as it comes. But as I said, please just be patient. I know it's hard. It just is changing so rapidly at the moment that, yeah, we're trying to keep up with it. So thanks very much for your support.
Thank you.
Thanks.